Hi, Mike Gibson, Siddharth Patel coming to you live from ESC 2024. We have new drugs out there, factor 11 inhibitors. They're supposed to be at low risk of bleeding, but a big question always comes up. What happens if someone goes to a procedure and they're on one of these drugs? For instance, one that has a half-life of 1 month. So, Sid, talk to us about what you found in this TIMI 71 sub-study.
Yeah, thanks so much, Mike. And I think exactly as you said, there's certainly a lot of excitement for emerging factor 11 inhibitor therapies, but a number of them are sort of injectable with long half-lives. And so abelacimab, which is the agent that was studied in AZALEA-TIMI 71, is one of them. And so this analysis was really looking at the subset of patients who underwent invasive procedures in AZALEA-TIMI 71. Patients were randomized to either abelacimab, one of two doses, or to rivaroxaban as part of the trial. And so, starting just first with the epidemiology, we found that invasive procedures in this patient population, perhaps as you would expect, were actually fairly common. It happened in about 1 in 3 patients. And so that is 36% of patients in the rivaroxaban arm and 34% of patients in the abelacimab arms underwent a procedure. And that proportion was balanced across all treatment arms, as were the baseline characteristics of patients undergoing procedures across their treatment arms. We found that in the vast majority of these procedures were actually low bleeding risk. So 76% of procedures were low bleeding risk. And then the vast majority were also elective procedures. So 75% were elective procedures. And in that context, we found that the rates of bleeding were low overall. So less than 2% of all procedures actually resulted in a periprocedural bleed. And the percentage of procedures resulting in a bleed were balanced across all treatment arms. So that was 2.2% of all procedures in the rivaroxaban arm versus 1.2% of all procedures in the abelacimab arms. And I'll just sort of give you the relevant background there. The majority of patients in the rivaroxaban arm had standard of care interruption of their therapy prior to the procedure. And so that is sort of the context for that comparison.
So interrupting a DOAC versus here you are in a drug that has a 1 month half-life, no increased bleeding, in fact, numerically lower bleeding with the 1 month half-life drug, a factor 11 inhibitor. So looks like is it fair to conclude it looks like it's safe in people undergoing procedures?
Yeah, so I think certainly the data are encouraging. One of the things to mention is that, just over half of all patients actually underwent a procedure within the monthly dosing interval. So potentially still fully on drug. And so in that context, there was no increase in bleeding, but the proportion of procedures that were sort of non-elective and high bleeding risk were fairly small. And so I think further data there will be informative, but at least based on the preliminary data that we have from Azalea so far, I think the data are encouraging that a long-acting and potent factor 11 inhibitor is feasible in this patient population that commonly needs invasive procedures.
Well, Sid, thanks for sharing with us today, and thanks to all of you for joining us here live from ESC 2024. Thanks, Sid.